Have you been told that your lateral hip pain is due to gluteal bursitis, but frustrated because treatments such as resting and icing aren't helping? Hey everyone, this is Dr. Zach Hewitt here, Performance Sport and Spine. In today's video, I'll be discussing why gluteal bursitis may not be the best description for your lateral hip pain and some alternates, and why exercise and postural modifications are superior to resting and icing. So if we talk about the relevant anatomy, if you take your hand and place it on the outside of your hip, you'll find a large bone. Now that's the greater trochanter of your femur or your thigh bone. Now right above that, the IT band runs across it, and sometimes it can compress a little bursa, which is like a gel-filled shock absorber. And we used to think that this was a primary generator of lateral hip pain, i.e. gluteal bursitis. So the gluteal bursitis diagnosis makes people think that it's an inflammatory problem and that they should ice and rest it. The issue is that things rarely happen in isolation, and it turns out the gluteal bursitis is more of a symptom than the overall umbrella problem. And so there's actually other stuff going on that we need to address. So at best, the bursa is a symptom of the overall problem, and it may not even be the problem at all. So we need to shift from resting and icing to strengthening and postural modifications. Because they found that extra compression on the bursa and tendons get irritated, as well as weakness in the general region can cause long-term functional deficits, such as walking, putting on your clothes, or going upstairs. And how things start matters. So let's say you're laying on a hard surface all day and you wake up the next day and your hip really hurts. That mechanism could have irritated your bursa, and maybe you do have more classical bursitis, and resting and icing will help. On the contrary, let's say you've had pain and weakness in your hip for months or maybe even years. There's more going on than bursitis. And if you just continue to rest and ice, you'll help the pain in the moment, but you're not going to fix the problem long term. So again, time matters here. So first and foremost, if you're stretching your hip or foam rolling it, stop. This tightness is not a lack of flexibility problem. Tissues are irritated and your body's protecting it. If you're stretching your hip a lot, trust me, if you take 2 days off, you're going to be happy. It's going to feel a lot better. Again, it's not about in the moment, it's how do you feel the next day. So with the following strategies, often one or two really help decrease people's pain. So it's important to note that you don't need to change all of them. Only work on the ones that help decrease your pain. So sleeping. If it's on your right-sided hip, it's best to sleep on your left side with a pillow between your legs, or on your back with a pillow under your legs. If you must sleep on your right side, place a pillow around it so the area of contact is not pressing into the bed, as we demonstrate here. So sitting. Don't sit with the affected leg crossed over the other. Try to sit with your feet a little wider than shoulder width apart. And if you have a very low chair, raising up may help decrease your pain. When standing, avoid leaning in or sinking into the affected side hip, as we demonstrate here, and try to keep your weight even on both feet. So walking and running. Some severe cases may be helpful to temporarily avoid these and do something like cycling as an alternative. When doing this, it's good to establish a baseline to know how many steps you can do before you flare up, so you can also track progress. And then some strategies when you're doing this is having a little wider gait or stance to help decrease compression, or to increase your stride rate. So if you're normally taking 100 steps, maybe take 110 steps in that same distance. And with stairs, it's important to keep our pelvis stable as we walk up and not let it tilt to the opposite side. So a helpful strategy is when you're placing your right foot up, use your left hand to hold on the rail to keep your pelvis level, and then alternate hands as you bring your other leg up. So initial exercises. In a standing position with your feet wider than hip width apart with your hands on your glutes, squeeze your glutes gently and try to rip the floor apart with your feet. Hold for 5 seconds. Work up to 5 to 10 times, 1 to 2 times a day. An alternate to this is laying on your back with a pillow under your knees with your knees slightly bent. Place a PT band around your legs just above your knees and do the same sets and dosage as the previous exercise. So moderate exercise. Laying on your back with your knees slightly bent with your feet flat on the floor. Lift your pelvis up with your hips. Hold to tolerance or 10 to 20 seconds, resting 30 to 60 seconds between sets, and shoot for 2 to 4 sets. An alternate to this would be just a staggered stance. So push your right leg forward a little bit and your left leg bring towards your buttocks, lift up and hold for the same set and dosages, and then repeat on the opposite side. So slow tempo glute bridge. Laying on your back with your knees slightly bent, with your feet flat on the floor, lift your hips up slowly for a 2-second count, pause, and then return to the starting position. Work for 6 to 8 reps, 2 to 3 sets with 60-second rest between. Advanced exercises. For the side plank on your knees, lay on the ground with your knees slightly bent and your elbow directly on your shoulder. Press yourself up into a side position and make sure your body is in line with your legs. Hold to tolerance for 10 to 40 seconds. Rest 60 seconds and repeat 2 to 3 times. To increase the difficulty, straighten your legs and lift yourself up on your toes with your elbow in the same position. Step up. Find some sort of step. You may need to adjust the height of the step to your current fitness level. Placing one foot on it, leaning forward, drive up with your hips. One thing to note is place your hand on your pelvis as we demonstrate here, and as you step up, make sure to not let the pelvis tilt to the opposite side, as that can increase compression. It may be helpful to hold on to a wall or a pole initially. Do 2 to 3 sets of 6 to 8 reps and rest 30 seconds between sets. Thank you so much for watching our video on gluteal bursitis. Again, we think of this kind of a misnomer, and a lot of people that are diagnosed with it suffer unnecessarily because the treatments that are derived from the diagnosis aren't really helpful. So again, lateral hip pain is probably all you need to do, and then strengthen the hip. If you did find this video helpful, please like it and subscribe to our channel, and don't forget to check out our other videos.